Welcome back to the Gestalt Get-Together. The Gestalt Get-Together is your podcast for discussing GLP, the autistic neurotype, the importance of musical language and psychoacoustics, and how our field is responding to the growing world of GLP discourse. Whether you're joining me for an interview or a research deep dive, I'm thrilled to be sharing my passion for working with GLPs with you. My name is Corinne Zmoos, MS, CCC-SLP. I love GLPs. I work with them every day, and I've had massive success using ideas from proposed frameworks like NLA. But I also identify myself as lovingly skeptical because I want more information, more data, and way more evidence. I basically live in the journal, so you don't want to know how many tabs I have open at any given time. But my goal is to synthesize exciting ideas from language, music, and neuroscience researchers so that you can grow your knowledge base and feel more confident working with GLPs. Tonight's episode, I am joined by a fellow SLP and someone who's really become quite a friend in this GLP space, Rachel Gorman, who's a speech language pathologist who I'm excited for you to hear from. We're going to be discussing a phenomena called monotropism, as well as something we refer to as attention tunnels, and how we might be seeing these in our GLP clients, as well as how we can connect to these clients when they're experiencing an attention tunnel in a way that's neurodiversity-affirming and really speaks to their existing neurobiology. And so I'd love to warmly welcome Rachel Gorman. Rachel, can you tell us about who you are as a speech language pathologist and how you came to understand Gestalt language processing?
Yeah, hi. I'm so happy to be here. I spent the first part of my professional life as a modern dancer and did a complete 180 and went back to school in 2007, got my master's in communication sciences and disorders and in New York City. And I didn't know at the time what I wanted to do or you know, what setting I wanted to be in, even what population I wanted to work with. I thought it was adults, and so I just went for it. I worked across the lifespan in urban and suburban areas. I was in Philadelphia, New York City, now in Connecticut. And I started in skilled nursing, always did a little bit of EI as I was doing that. I Then I shifted to home care and finally back to New York and outpatient and rehab setting, day hab setting, then into schools, and then finally into where I found my niche. It took me a while. I really thought I wanted to work with adults, and I went from working just down the lifespan essentially. And when I was at Rivendell School in Brooklyn is when I had when I worked with the most impactful teachers and therapists and school directors of my career. And that's where I really became interested in what's what I thought was my first exposure to autism and that whole world. And then I had children in 2013, and then in 2018, my second child, it didn't go the way I thought it would. There were growing pains that sort of brought all of us, all of our varying diagnoses to light, I'll say. And, we struggled, admittedly, as a family, and it it was hard until we settled into it. And then I experienced life on the other side of therapy. So, had been there as a therapist, thought I knew everything, had kids, realized I didn't know anything. And it was lonely in a way because we were sort of isolated. And so I became, I had, I, during that period of struggle, I had to put some pieces together myself. I didn't have anyone to say, hey, here's what's going on, or I really had to take the lead. And I think it was through that experience where I really found my footing. As a student and as a teacher, I learned a lot about Gestalt language processing through all of the amazing resources that I sort of stumbled onto because thank you, social media. And my interest and passion kind of grew from there. And that experience really tested my resilience, I think. Even in birth to three, I had providers saying, yeah, we don't know. I'm at a loss. I asked the speech therapist pointed questions and nobody really knew. It wasn't an area where, Gestalt processing wasn't an area that was known with any of the providers that I was in touch with here and that were supporting our family, any of the teachers in the school. And so my youngest is a GLP and PDAer, and it's very fun in our home. And so there's a diverse mix of humming, scripting, singing in our home. And my practice, Every Mind Speech, which I finally hung my shingle a couple of years ago, was born out of is creating the practice that I wish that I could have found for my own kids. And basically, you know, wanting to support clients and their families beyond just the time that we spent together in the treatment room. So my favorite thing is fostering connections, that moment where I can help kids and their parents sort of see each other. I live for that. And I try to bring that background as a mover and a teacher of motor skills into my work. So that has been great to marry those two together. And then, yeah, I just really enjoy pursuing that, my special interests through my own practice and through my clients.
Yeah, it's so interesting the connection between your professional life and then your personal life and how those have informed each other. I'm wondering, what were some of the early indicators for you that your child was a GLP, even before you knew what that was called?
Yeah, before I even knew, I remember saying to my birth to three provider, he's saying the same thing, but I don't know what it is. And I knew enough. I knew about apraxia, and I knew that it was so different from that because it was so consistent and it was so rich and so, I had no idea. And so there was a lot of that intonation, rich intonation, and that just sounded
Yeah.
and like that body movement. He uses a lot, like echopraxia. And so he really embodies the which I didn't know then, but sometimes like he would do a lot of kicking and everyone was like, it's sensory, it's sensory, it's sensory. And it turned out, later that that was part of, he was pretty dyspraxic, but it was like he was trying, it was echopraxia in a dyspraxic body. So it's like the car is racing down the road or whatever it is, but it manifests in kicking, but it's not kicking. It's reenactment of whatever it is. So I think I definitely learned a lot about everything's not sensory. I mean, there are a lot of things are, but it helped me make that distinction along the way too. But yeah, a lot of repeated little scripts and sounds.
Yeah, what an interesting phrase, echopraxia in a dyspraxic body. That's going to stay with me for sure. When you think about how you've, interacted with your own kid, and I'm just thinking about how interesting it is to like be working with GLPs all day and then come home to a GLP. What do you feel like is one really core idea behind supporting a GLP that you'd want people to hear that goes across professional and personal?
Yeah, that's a great question. I think mindfulness is
Okay.
huge because I think of a letting go in a way. There's definitely a delicate balance between seeing or hearing, listening, observing, and doing.
Okay.
And I think my my youngest is complex because of the PDA, the demand avoidance profile, and the Gestalt processing. And I think if you can be present and also just dig into it, right? Like really lean into the experience of it and sort of try it on. I think, that we're working all day and getting to be a part of these different experiences and seeing how it looks so different in every child, and
Mm.
every child has such a different thing going on, and there are a lot of parallels that I can make and a lot of stereotypical things that you might see, but I think for the most part just being present, because we have to remember that we have this clinical lens or this parent lens, right, of what we think is supposed to be. We're have to do the session this way, or this is our plan, or this is our language goal, whatever it is.
Mhm.
If you're not right there, you're going to miss everything that you went in trying to get to begin with. So really being mindful, being present, being a listener, and then seeing where that takes you.
I think what you're speaking to, we're going to hear about later on, talking about attention tunnels and monotropism is tonight's topic. There was a conference by someone named Dinah Murray, who's really one of the pioneers in talking about monotropism. And she talked a lot about kind of that being in the moment and kind of being a follower and following the lead of the autistic child and really being in their moment with them. And so that reminds me a lot of what we're going to speak to in a little bit, which it feels like an apt segue. And, as we were thinking about what we wanted to talk about in this episode, we were thinking about the importance of special interests, about joining a kid exactly where they are as a Gestalt language processor. And there's this topic of monotropism that I've been reading more about, and I was really excited to discuss it. And so I want to give a background for our listeners that monotropism is a theory of attention. It was developed initially by Dinah Murray, Mike Lesser, and Wen Lawson. And though it focuses mostly on describing autistic attention, it really can be considered a way of thinking about the range and distribution of all human attention, likely, like most things, on a bell curve. And in 2005, they put out a paper called Attention, Monotropism, and the Diagnostic Criteria for Autism. And they were discussing how attention is a finite cognitive resource. And they used a really cool optical analogy. And I love analogies. I live for a good, give me good like imagery. So they were saying that attention can be as focused as a flashlight beam, or it can be as diffuse as like an overhead lamp. And depending on the neurobiology of the person, you can be really, really focused light particles like a flashlight, or it can be more diffuse of where your attention falls. And people fall different places in between. And they described how autistic people tend to fall on the flashlight end of things, really, really extreme, tight attentional focus. And they were mentioning this Murray, Lesser, and Lawson, how social communication, language, reading social cues, all the stuff that a lot of the people listening to this podcast are tasked with working on, that requires a lot of diffuse attention. That requires the big lamp, not the flashlight. And so the goals that we're working on as speech pathologists, speech therapists, are kind of in stark contrast to the attention resources of the clients in front of us. We're looking for more of an overhead lamp, less of a flashlight in the end goals that we have. So I'm going to pause there, but Rachel, any thoughts on that first bit of information about monotropism?
Yes, it makes me think a lot of transitions, and that when we have this intense focus on something and we're really in it, and all of our resources are going to that thing, and then we want to flip that script or whatever it
Yeah.
is, there has to be like ramping up again, right? We've got to sort of plug it into the new socket and like turn the wheel,
Mhm.
right? The old way to
Yeah.
ramp it up, put the coals in the fire, whatever it is. And that time to sort of key into the next thing and find that point of interest, I think is huge. And I don't know. I think also monotropism can be viewed as a negative, right? Everything in the DSM says it's all deficit based, right? So
Yeah.
when we see things framed as restricted or repetitive interests, right, as a diagnostic criteria in the DSM, the current edition, we think about what's not there or what's a weakness, right? Instead of, wow, we can really hone in on this thing. And I have
Yeah.
several clients who, and even my own perfectionistic tendencies with something, right? Like if I'm in the zone, it's my family's like, hello, you gonna come upstairs? Like, you know? So I think that those things can be viewed a little bit negatively, but they can really be strengths. I think that it allows you to focus more deeply and use, if all your resources are in one area, you may miss some other things, but we could also look at it in the way of, we might catch some things that others might miss.
Yeah, it reminds me when you speak about transitions, I have a couple anecdotes and interesting quotes related to transitions in particular, but it reminded me of, have you heard of tendril theory?
Yes. Yes.
So,
Yes. Yes.
so
Yes.
this is,
Yeah,
oh
I've
yeah,
seen it referred as like inertia
yeah,
or
autistic inertia.
yeah.
Yeah, so tendril theory is from 2015. It's by a blogger. E is for Erin. You can find her at eisforerin.com. But there's actually a really lovely visual of someone with all these tendrils coming out of their head. And it's entitled Why It's Hard to Switch Tasks. So I just want you to imagine there's a person with all these curly tendrils coming out. And it says, when I'm focused on something, my mind sends out a million tendrils of thought, expands into all of the thoughts and feelings. When I need to switch tasks, I must retract all of the tendrils of my mind. This takes some time. Eventually, I can shift to the new task. But when I am interrupted or must switch abruptly, it feels like all of the tendrils are being ripped out. That's why I don't react well. Please just give me time to switch tasks when I'm ready. So, tendril theory. And I've seen that so many times, especially when I think back to some of my early clients. The amount of tendrils I used to rip out is heartbreaking. Heartbreaking to think back.
Oh yeah. I have a lot of those moments thinking back to that first early childhood experience that I had as a professional. And I think I've thought about every single one of those kids like every 3 days I mean, how long has it been? It's been what, 15, like 10 years. So it's like, yeah. And I think about I'm like, oh, this is what was going on with them. Yeah, it's insane. But that time, that time where the tendrils are coming back down, where we need to reallocate resources, it is so tied into interest, because if our sensory system can kind of like realign itself into a new point of interest, I that is where you get sort of the buy-in to the new thing, right? It's like, okay, I'm going to shift to this new thing. So what? Who cares? And if we are feeling safe and if we can see that point of interest in the new thing, then our tendrils can go whoop, right? Like all the way back out, and then we're ready to go.
Oh my gosh, you keep bringing in so many of the same terms that I'm excited to talk about too. This is great. Yeah, the word interest is so important. A lot of us already know about special interests, but even that can be kind of used in a pejorative way, I found. Like, oh, it's just a special interest. It's just a special interest. But really, if we think about that word, so the major hypothesis that Murray, Lesser, and Lawson talked about is that autistic monotropic individuals have fewer interests, but they're more highly charged or emotionally charged. Whereas neurotypical or what we call polytropic individuals have more interests, but they're less emotionally charged. And so some people have monotropic tendencies and some people have polytropic tendencies. Rachel, where do you think you fall?
I think so. I thought that I grew up thinking that I was an extrovert with polytropic tendencies. As it turns out, not so much. And I think the more that I lean into that, how would you say, like monotropic state of mind, or if I honor that monotropic neurology, right, then I'm usually coming out of it better for it.
Mm-hmm. Interesting. Yeah, I think for myself, I really wonder. So I have ADHD, and so for me, it feels like polytropic, even though I'd rather not be. It's that my attention is so diffuse in a way that's almost distressing. It's like too diffuse. And so I kind of marvel at monotropism and I feel envious of it in some ways because my goodness, how amazing would it be to actually be able to focus on something? But I do know that in the moments when I have entered into, I know it's not truly a flow state. When I hear people talk about flow states, I'm like, that sounds incredible. But the times when I have been able to have more of that flashlight attention, it's a profound feeling. So I definitely have some monotropic envy with that one. And I'm
Or,
curious. Oh, sorry, go for it.
yeah, sorry, I was just gonna say that I think, and uh, another way that I think about it, and I'm not sure what the research says about it, when there are fewer resources and perhaps processing is delayed, if we are able to get into that monotropic state, it's I think it can be a way of focusing in a way, right? And so I don't know. I think even a monotropic brain might not easily be able to get into a monotropic state. However, they will have an even harder time, you know, in trying to split interest and attention. So I don't know if there's a correlation between monotropism and in, I think because there's such a wide spectrum, I have clients, one of which just keeps coming to mind thinking about monotropism, and when it is like so just in a way that I don't experience it, but I'm guessing that there's a range of it. But I think if we honor that neurology that we're born with, if we kind of figure it out, right, then and lean into it a little bit, that's where, right? So I know, like, there are clients I think of, and humans that I know that are just naturally in a very deep monotropic state. But I wonder if there's some validity to, difficulty splitting attention and being able to sort of focus on one thing, but still have some attentional difficulty.
Yeah, I mean, I think that's where it comes into that idea of like the bell curve and then the normal distribution, but also thinking about like other comorbidities as well as the environment. I mean, we're always talking about with a GLP, with any human, but with a GLP in particular, the environment is going to have such an impact on how cognitive resources can be allocated. And so there's an autistic adult named Kieran Rose, an autistic advocate and content creator who really talks about attention funnels. And so monotropism, attention funnels are two related concepts. But I want to talk more about attention funnels and kind of related to what you just spoke about. I think Kieran Rose is a good creator to reference. So attention funnels. When an autistic monotropic brain kind of hooks into a topic or task, and I really want you to think about this idea of like hooking in, just like, zhoop. And I know I've certainly felt that with certain topics. I mean, I my relationship with Gestalt language processing and music is certainly one that is hooked in. But when an autistic monotropic brain hooks into a topic or task, Kieran Rose talks about there's this locking in effect and this pull that they refer to as almost gravitational. So there's this pull in, this singular focus, this momentum. I mean, there's weight to it. It's not just, oh, that's interesting to me. It's a pull. And Rose describes that there's this intensity in this attention tunnel that can be related to a flow state. So the flow state for some people can be really soothing and enjoyable. For some people, the intensity of it can be like really pleasurable. So the emotional experience of a flow state can be different for each person. But what a flow state and attention funnel can do is it takes a person who is learning about something or exploring something into a deeper state of pattern recognition and a deeper level of study. Very often when I'm talking to families about their child who's, in a monotropic state or in their attention tunnel, and I'm talking to them, I say, your kid is studying right now. It might not, that word you might think of as related to like sociology or like formula or like what studying something in college, but I see your child truly studying the sensory phenomena in front of them through this attention tunnel. And it can be a deeper level of study and interaction with the things in front of them than a neurotypical brain may ever experience. But what's also interesting is that people outside that tunnel, objects outside that tunnel, events outside that tunnel might get missed. But I think it's really important, missed but not ignored. Because I think that there's a lot of talk about autistic kids of being like, oh, well, they're just not paying attention or they're not listening. What if we could shift our perspective and just try on the idea that it's not ignoring you? Their brain didn't even note it because it's outside of the attention tunnel. That sensory input of you and the thing that you were saying or the thing you were doing, it wasn't within that tunnel, so it wasn't necessarily registered in the way that you're hoping it was registered. So,
Coming
yeah,
coming from outside, and it's not a part of that experience. It's a totally different experience,
yeah.
and their resources aren't there, they're here.
And they're not within the gestalt of what that child is reenacting potentially or learning about. It's an unrelated sensory factor. And
No.
I think speaking back to the environment part of it, so Kieran Rose talked about that when an autistic individual is uncomfortable or feels unsafe in their environment, sometimes they may go even deeper into an attention funnel as a way to self-soothe, to find order, to organize themselves, and to feel more regulated. And so sometimes, you know, I feel like I'm at the point now of working with GLPs where I'm wondering if this is the case for you or for anyone who's listening, where you can tell the difference between like a calm attention tunnel and I'm saving myself attention tunnel.
Yeah. That when I had a there's a new I have a new little one that's new to me, and first when he came into the clinic, he shut the door. There's a door in the middle, but like separating the rooms, and he shut the door. And he was kind of on the other side, and there was a lot of like swinging and just sort of like really quick back and forth between things, and just like really using some scripting that was had that emotional undercurrent to it, and just like super repetitive, and breathing was more shallow, right? And I think there's trauma, right, that sometimes is brought in terms of like, oh, this is going to be another, you know, of the same therapeutic experience that I've had over and over and over again. And, thankfully I could, I recognized that, and I understood where to come in, and how to join in without, creating any more trauma and creating space for that child to show me who they are and that I'm not really threatening and, we're safe. And by the end of the session, I mean, I felt like we were besties, but that initial like or a child that comes in and it's just like constant chewing on their chewy, right? Just like chewing, bouncing, chewing, bouncing, chewing, bouncing, chewing, bouncing, which, the parent was like, oh yeah, they always have their chewies, whatever it is. But I noticed that like over time, right, with relationship, with safety, if we're a good match, that kind of goes down, which sort of tells me like, I'm regulated. I'm good. I don't need that.
Yeah, the feeling safe piece of it is so critical. And I think it also gets tricky when we think about I've worked with a bunch of clients, especially when I think about like the autistic girls I've worked with, where the masking of the anxiety and covering that up, well, we can really get through even that. And for them to feel really, really safe where they want us in the attention funnel with them, right? Joining in. And there's some other fun analogies I definitely want to get to that remind me of that feeling of like we're like getting into that tunnel with them. But I'm thinking about, you're bringing me way back to a client I had. Actually, the client who like started it all. I've talked about this client before, but I don't, you've heard so many of my anecdotes, Rachel, about this client who was the reason that I even started looking into music and music theory. He was the one that was singing and speaking with octaves in his voice, and he was just the one where I was like, oh my gosh, there's mathematics in his pitch. But there was one of the first things I ever did with him before the music started to click was related to attention tunnels, pardon me. And before I even knew what an attention tunnel was, he just reminded me of this. It was our second or third session. The family had just gotten an autism diagnosis. They were reeling. I was their first therapist ever. They were just found out what early intervention was. And I walked in the door. This kid saw me and had a complete, he was so scared because I was a strange person who just walked into his house. The whole family was just, whew, they were exhausted. And the first session, he cried the whole time because it's terrifying. A random person just comes into your house, and I interrupted the gestalt of what home was for him. Now looking back, knowing he was a GLP, but I'm thinking my second or third session, I was talking with the family. We are just kind of observing his play. And what I now know is that he was in an attention funnel where he had lined up about 5 books in a horizontal line. And he was going through, and he would go through book 1 and flip through all the pages. He wasn't reading, he was just flip, 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 flip. Book 2, flip, 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 flip. Book 3, flip, all the way through. And the family was saying to me, they were saying, we keep trying to join him, and whenever we get close, he screams. He screams, and he goes, no. And they said, well, we've been trying these, we looked up strategies, like we should narrate, we should like sportscast what he's saying. But he screams at us and says no. And I was just seeing the intensity of focus. And anytime anyone went over, he almost looked scared. It was this fear response, which when we think about monotropism, attention tunnels, maybe that was kind of a tendril, like ripping the tendrils out. He was really, really focused. And so what I did was I said, okay, let me just try something. And that's often a phrase that families will hear from me. I'm like, let me just try. Let's see what happens. So I went and I got 5 books of my own and I lined them up, but I went to a pretty good distance. I was about 10 feet away. And luckily it was a very nice house. They had a lot of space, so I could be at a nice distance from them. But I lined it up and I imagined that there was a mirror between us. And I mirrored him and I tried to get into a flow state myself and try and figure out, why does this feel so good for him? Can I also experience what he might be experiencing? So I got down really low. I copied the exact body position. I tried to be just as focused in, and I flipped the page at the exact same pace, and it was really, really soothing. It was extremely soothing to be that low to the ground, to be getting this visual input, and to do something in this nice sequence that had so much order to it. And so I had the experience of relating to why this might have felt so good to him. But then, and I see you smiling because you probably know what's going to happen. He looked up at me and just this look on his face of like, what? And then I just kept going and he kept looking up and I saw his shoulders drop. And this was a child who was coiled, just one of those kids who's coiled so tight. You could tell the world was a scary place for him. And his shoulders dropped because I think because of the mirroring, but I had joined into that attention tunnel with him. I had made my own. And so our tunnels looked pretty similar. And then he started to flip at a different pace to see if I would do it too. And from there, it was like, I mean, he ended up being like one of my, I know it's so corny, but like really one of my greatest teachers. But it really all started because I said, okay, let's look at this tunnel. Can I understand why? And I don't actually need to, we don't actually need to understand exactly why that tunnel feels good, but I wanted to experience it. And then by doing that and through the mirroring exercise, that sign of safety of those shoulders dropping, it really did open up such a door. So thanks for reminding me of that experience.
I love that story, and I love that story so much. I had a similar ish, in that same vein experience with a client who he loved he loves letters, and he'll go between things, but he has to do it on his own time. And so when you get close to him, you get, no, no. That's what you get. No, or just like screaming on the floor, irreconcilable. And so he would play with this baby shark puzzle. Like he loved baby shark. And one of the first times I saw him was with a baby shark puzzle. And he had one, and I had one in my bag. And he was just sort of putting the pieces in and then taking them out and putting the pieces in and taking them out, putting the pieces in and taking them out. And then he would go to like the next thing, and he was just sort of like taking things in and out, or like this letter case, taking things in and out. And I just kind of mirrored him a little bit, and then also left him alone a little bit and stood back, got really low, like got on the floor on my belly. And I think this is like where my dancer self likes to live. I joke that I should call myself the barefoot SLP because I am usually like that in my clinic, just like on the floor. And just like on my belly or on my side, and just kind of like sitting there. And every now and like, I got a different toy out, was doing my own thing, and then I would just like hand him something. And that's kind of how it started. Like there was a piece on the other side and I would hand it over, just like put it in my palm, and he would take it, or just kind of have something off to the side, and sort of layering language onto that and trying to get in that way, and just not changing anything, right? Just not changing anything, and acknowledging what he was giving me. And
Right.
then at the end of that session, I think the language grew a little bit. And then by the end of the session, he had gone to the kitchen to get a granola bar. And I was seeing him in his home at the time, and he went to the kitchen to get a granola bar or something like that. And he brought it to his mom, and he put it on the table, and he goes, "Hungry shark?" And
Ooh.
and mom totally missed it,
Oh,
because it was like an approximation, but we
yeah.
had been singing the song, do 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 do, and
Yep.
then hungry shark, do 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 do, and he puts it down. He was like, "Hungry shark."
That's brilliant.
He wanted to eat and he wanted her to open it. And she kind of missed it because
Yeah.
I think as a parent, I totally get that. I think I missed like 75% of what was going on in my children's sessions, if not 90%, because oh, like just like there was so much, trying to listen to what the therapist was saying and then watch my child like see like stop talking to me, you're losing him, like just like going back and forth between that. So
The
I
code
totally
switching. Yeah.
understood it. And I think I
Yeah.
was listening for those things and I'm understanding how to listen for those things. And I think it was harder for mom to parse that out and that there was meaning there, right? And
Totally.
but yeah, he was like,
Wow. Hungry shark. That's such a great mitigation. I love that. And, it's interesting. There's a phrase that's it's stuck in my brain that you said of like I didn't change anything about the play. And I think immediately in my head I had a voice that said, "Well, that's because you were the change." And sometimes like us being the person joining in, that is more than enough change for the play. And sometimes it reminded me of something else that Kieran Rose talked about was this idea of like shifting the attentional focus out to something else that it includes just the presence of our body near them. Just being near them can require an attentional shift that might be dysregulating. And so just for you to be near and handing things, to me, that is an area that we could consider growth of like, oh, well, this child was able to like increase their feeling of safety with me being near them. That's a sign of progress. I think there's also like I think there's a tough expectation on a lot of GLPs and autistic kids, expecting them to shift at the same pace as a
mm,
neurotypical brain. And considering like the momentum and the gravity of that tunnel, like being yanked out of that tunnel can be really dysregulating. It can lead to annoyance all the way to like distress and confusion and like all those feelings that can come up. And so when I hear about, anecdotes like you joining in and just handing things and it being this smooth addition, this kind of like, I know it's like such a like lofty, like kind of almost like spiritual word, but like offering, like you make an offering. And I don't know, I get a little weird about like kind of like spiritual vocabulary in the SLP space. I feel like there's a lot of that happening, but like it truly is like I'm offering you something. And if it's accepted, that is a sign of growth and stretch in that play scheme.
before having children, I used to love to go camping
Yeah.
and like backpack camping, putting all the stuff in a bag and trekking out. And we would go with friends and often, and we used to joke with our friend that he was curating camping experiences, right? And because it was a whole vibe, right? Of, finding the right spot and I truly, once you're in it, you're like, yes, that is important, right? And the right, especially when you're walking into the forest, right? And I love that word offering because I do think of it like that. It's like curating a magical experience or something. And that's, I don't plan sessions in the way in terms of objects or toys or like curriculum, not in terms of like like with GLPs mitigation planning and thinking about their rhythms and Corinne, all your work in turn with, recognizing these patterns and musical language therapy is amazing. And that kind of planning, yes. But I no longer will have a whole session plan in terms of, first then, or what's going to happen, or we're going to use this thing, or we have to do X, Y, or Z. And now I think of it like curating an experience, right? Like, and I'm just there, I'm just the like DJ.
Okay. I'm gonna chew on that. I'm just the DJ.
you know so there's it's their party.
Yeah. Well, it's like I think about how like so there's so much about like intrinsic motivation versus extrinsic motivation. And like when it comes to autistic kids and GLPs, it's all about that intrinsic motivation. And Attention tunnels, you could argue, are like the height of internal motivation. A flow state is the apex of intrinsic motivation. And I don't know what is going to be like what is going to be internally motivating to my GLP one week to the next. Some kids have the same special interest for months, years. Currently, my caseload of GLPs, I can't keep up. Like every week there's some new interest. And so if I were to plan exactly what you're saying, like I plan like potential mitigations, I plan grammatical targets that I might integrate. I plan what I'm going to coach the families about, but I cannot plan for what the interaction with that child is going to look like. And if I do, those are the sessions that like don't really go as well because I'm trying to bring in like the extrinsic stuff into it. So I totally relate to that. But yeah, I think I just wanted to highlight how like attention tunnels, those are so much internally motivated. And if we're joining into something that they're already focused on during the session, we're building upon the motivation that's already there. We're not trying to create new motivation. It's already there and we can leverage it and we can join into it.
Yeah, and it, you know, when you think about it works well for me. It's you know, within my own practice, I it just works really well for my brain and the way that I think and the way that I like to practice. It's like, oh, okay, we're going there today. Awesome, let's do it. And then like put me in a room with a padded room with a stick and I'll, you know, make some magic
I say
happen,
that
right?
all the time, but paperclip. I say, put me in a room with a
Yeah,
paperclip. We can do it.
let's do it. Like, yeah, and I love that. And I think that like ADHD part of my brain, right, wants to do that. And it, yeah, I mean, when I think about joining in and meeting a GLP where they're at, it, I, you know, it's for me anyway, what I found to be effective in my space is, you know, being present, approaching with curiosity, and then kind of curating an environment, you know, for which to be like the container for the thing. I have one client, who he likes pairs of things, like loves pairs of things. And like the sameness of them. And he doesn't, he's stage one, he's in NLA stage one pretty solidly right now and moving, I would say like he's probably like 30-40% using stage two, and he's following not many of my clients do, but he is like pretty textbook. We can really like see these patterns, right? And just beautiful and clear. It's not ever like that. It's like such an anomaly to have a client like that. And he knows what he wants. He's like has so many ideas, but he is, I would say, unreliably speaking. And you could tell that dyspraxia is also verbal dyspraxia in some way is like part of his experience. And he will come up with something and I'll, you know, he said colors of the rainbow. And I did not know what he was asking for. It took me a minute and colors of the rainbow, and I almost missed it. Like it was so like he kind of didn't have the tune right away. He couldn't, it was like on the rainbow. And then and it was almost like more less melodic than that. The rainbow. And then I started to hear the tune of it. Colors of the rainbow, colors of the rainbow. And the more he said it, the more I could hear the melody in it and the sort of change in pitch, because he can also be very like da da da, you know. And I remembered that the week before I had brought out a parachute. And I was like, oh, it must be like, and I like ran upstairs, I ran back down, and I got this thing. And then in our going to get the other thing, he noticed this other pair of birds that I have. And he was like, So it's like, all right, let's do it. So I got the birds and I put that parachute over us, and we were in this like little container with like the things that, that's what he wanted. That's what he needed. And so, and just modeling, he has a talker. And so he hasn't been just been modeling without expectation, and he doesn't necessarily like reach for it with his hands or anything, but he's responded to some of the models on it, but he tends to like my voice a little better. But I incorporate the two, so he'll
Yeah.
have that.
What software is he using?
He's using Grid
Okay. I
for
haven't tried
quick
that
smart
one
block.
yet. I've heard of it. You like it?
I do. There's things in, I think no one AAC
No.
software seems perfect, but the
No.
benefit with Grid is interesting because you go to what's called the compass. It's like the compass,
Okay.
and it's called Grid Explorer. And I think it's so interesting for GLPs because so like the app or the software that you would open for touch chat, let's say, it would bring you to touch chat, right?
Mm-hmm.
But then imagine having like lots of different grids. So you can close touch chat and open another grid. And so that's how Grid is. It's like
Okay, interesting.
so many different grids. And there's one that's sort of like Pod, so called Voco Chat. And so
Okay.
it builds sentences a little more, like it'll take you to where you're going based on what you've said, the way that Pod does. So it'll
Sure.
bring you over to like, if you're like, I want, and it'll bring you to a page with like things that make pragmatic sense along with that. And then there's a 50 grid and a 30 grid. And then there's like all kinds of things. There's games, there's experiences, like little gestalts that also have like a related communication board with them. There's sounds,
Mhm.
there's like I think it's just interesting because it combines core and fringe in a really
Yeah.
interesting way. And then it combines like there's like the topics and the quick things or whatever, but it has phrase-based on the right side of the screen. It has a lot of phrase-based stuff the way that TD Snap might, but it's like
Yeah.
very related to so if you go into like daily, you'll have your core and your fringe, and then you'll also have phrases and open it up into more phrases. And then it has a messages feature where it's organized by like it'll say like, and if you open it, it'll bring you to a whole. So it's kind of like what we do with core words when we're
Yeah.
programming for a GLP, but it's
Yeah.
sort of like built into the system in a way.
Okay. I gotta check it out. Yeah, I haven't seen it before.
And for my GLPs that love to jump around and like um I have one GLP-S who we've talked about before.
Yeah.
He's very auditory. He gravitates towards videos to communicate. Uh,
Yeah.
but like not necessarily like in the AAC. He doesn't want it in the AAC. He wants to
Okay.
like find it in other ways, like or like listen to two things at once in stereo or three
Oh
things at
my
once in
gosh.
stereo
Yes.
and like a video of a video of a video. Like so
Yes, yeah. He's going so deep. Yeah.
yeah, I lost my train of thought, but the grid for him was really he connected so deeply with it because he could go out of he like loves to bounce around and to manipulate things and to change them from what they were to something else.
Yeah.
He reprogrammed actually a whole grid in Chinese, which he doesn't. And then he went right to operational competence and then like deleted everything in there. And then we put it all back. And then he like found his own grids and like he went deep in there.
Yeah.
He like edits everything and like he's
That's
not
monotropism. Yeah. That's it.
communicatively
Yeah.
in the way that you would think, but he is deep in it.
Yeah.
I mean, it is in that funnel big
That's
time. Like,
exactly it. Yeah. And like the level of study that you're speaking to. And like that is, and the fact that you're meeting him there, you're saying, okay, I'm there with you. Let's do this. That's it. That's it. That's so much of where I think the next part of what I want to talk about is, I mean, oh my God, there's so many things I want to talk about, but this idea of, because I know a lot of, I don't know, I love talking about theory, I love talking about research, but there's a lot of SLPs, especially SLPs, who are in settings that are a little less, there are some settings out there that are really, really tough. You and I have, I think, a lot of, we have just like the immense privilege of being able to craft our own setting. But I know I hear from a lot of SLPs that are like, okay, but just what do I do? Please, what do I do? What do I do? And there's two terms that I want to talk about. We've been touching on the ideas, but really naming them. So the first is this idea of skilled noticing. Like, what is, like, I'm engaging in skilled noticing of what this child is doing. And then there's the other one, which is this idea of gentle joining. We've kind of spoken to both of them in little ways. But as a listener, if you're listening to this podcast right now, thinking about skilled noticing, how do I already engage in this with the clients I'm working with? And then think about what gentle joining might be. How do I already gently join in with what an autistic child is doing, what a GLP is doing? So you've already spoken to kind of this underlying idea of skilled noticing in some of your anecdotes, where you're slowing down, you're being really, really remarkably present in what this child is already doing, and you're saying, okay, what's the meaning behind this? Like, what are they learning right now? And instead of coming in with your own ideas, noticing and observing. And there's a conference talk from 1996 by Dinah Murray, who was one of the people who really pioneered talking about monotropism. The talk was Therapeutic Intervention in Autism, Perspectives from Research and Practice. And there's this quote that I want to share that relates to this idea of really like following the child's lead and skillfully noticing what they're doing. So this is the quote. And this is from 1996, a while ago. If we're trying to interact with individuals with autism, we are liable to intrude excessive stimuli and to disrupt predictable structures just by being ourselves. So I want to pause there. We spoke to that kind of just our bodies coming in can be disruptive. But this phrase, predictable structures, I thought of that because you mentioned that child liking the pairs of items, the dyads. That is a predictable structure. And I don't know if you remember, do you remember we talked about, this was years ago when we did the course, isomorphs? Yeah,
Oh, yeah.
veridical mapping, isomorphic
Yes.
structures. So this idea of autistic individuals are looking for isomorphic structures in the world. I've had a couple of clients over the years who love to create pairs of like mommy baby everything, mommy baby shark, mommy baby pillows, mommy baby water bottles. That's a predictable structure in the world. So it just reminded me of that. So back to the quote, we're liable to intrude excessive stimuli and to disrupt predictable structures just by being ourselves. And this is so Dinah Murray's from the UK, so instead of caregivers, they say carers. So I'm going to say carers. Quote, the more carers play a following role, the more likely that the children are able to relax their rigid attention tunnels to potentiate comfortable other awareness. So, translate. The more that we're able to take on the role of follower and noticer, the more that our clients are able to relax their tunnels to potentially feel really comfortable with being aware of us and what we're trying to do. Now, quote, what is gained for the individuals who can now successfully engage with one another in this other accepting state is better communication, and it gives them the chance to exchange human warmth. Human warmth is a huge stimulus for most of us. It fills us with good cheer. So making opportunities for such exchanges is making opportunities for good feelings to flow back and forth between the individuals concerned. For children with autism, those opportunities will have to be created by carers setting aside time in which the child's interests are paramount. For carers, playing a following role may involve their paying extremely close attention to someone who is not trying to let them know what their current focus of interest is. End quote.
Yes.
Yes, right? Yeah.
Yeah. I mean, and it's not dissimilar if you think as a clinician to, someone goes into the doctor's office and they're talking about everything that's going on. Meanwhile, the doctor's just noticing, right? Noticing the color of their skin, noticing the bags under their eye, whatever it is, noticing their posture or gait, or noticing, something's going on with the side of their face, right? There's an asymmetry, right? And so I I think, or noticing anxiety, whatever it is, we as clinicians are taught, and I think the way that we are trained in having to perform for our supervisors in our clinical years really puts you in the mindset of, I every day I realize how I'm just undoing pretty much everything I've learned. I mean, not everything. I hats off to my professors, and I certainly, have a deep respect for the educational institution that I had the privilege of learning from. There were so many amazing things there, but I think it's just a systemic thing, right? And there's this performative aspect to it, and we're not really taught to, like, hey, take your time. What do you notice? What's less obvious? Like, and how do we do that in a way that doesn't take away from, the experience of the human that we're really there to not manage and not what's the word, direct, but to support, supporting what's there. How can we do that if we're not being attentive and taking that step back to notice it?
And I think that's why I really love talking about the autistic neurotype and like neurobiology, is because if we can really, not that, oh my gosh, when are we ever going to really actually understand the brain? Not anytime soon. But this idea of like, we are looking at a fundamentally different neurostructure. We are looking at a fundamentally different, like, wiring system. And to expect the same results as a neurotypical brain, it's just, to me, it's not like logical. And so if we can really understand as best as possible the autistic neurotype, the difference in oscillations, the difference in the basal ganglia, the difference in the cerebellum, I mean, the differences are everywhere in structure and in function in the autistic neurotype, brain and body, it can help us be like, to slow down and say, okay, we got to be a little bit more creative because we're dealing with different hardware. And for me, it's just important to keep coming back to that so that I can continue come in with slowness, with patience, and pay attention, rather than trying to, like, again, where I was trained, where I learned with also a lot of respect. In fact, I got a really great education,
Yeah.
but also I am unlearning a lot too. So it's both. And so the idea of like the skilled noticing, that's one side of it, is creating those opportunities where the child's interests are paramount, we can really study. But then the other side of it, that other phrase that I think I want listeners to come away with, is this idea of the gentle joining. And we've spoken towards it. We've had a couple anecdotes where we kind of talk about ways of gently joining in. But I do want to also, well, I want to give another anecdote of mine, but I also do want to reference a paper related to the schools, because I do hear feedback from a lot of school SLPs that are like, Corinne, your ideas are really nice, but it is not the reality. And so there is a 2018 paper I do want to reference related to these ideas in the schools that I think could be supportive, especially for school SLPs who might want to present research to maybe supervisors who are like, why are you using this child's like obsession in your sessions? But let me give one example, give one anecdote first, and I'll get to that paper. So the idea of gentle joining, I think back to, I had a little boy I worked with in a preschool years ago, and this was also before I knew what GLP was, but I look back and I'm like, oh my God, you were such a GLP. So he would line items up on the floor. He would do the side lying and line things up. And he was so peaceful. He really enjoyed it. But when it was cleanup time, his teacher would walk over and start cleaning up his line and then say, it's cleanup time. So she'd start picking up. And then I know. And this child would just be like wrenched from his attention tunnel. And he would just straight into like extreme distress, so confused, he'd start flipping over chairs and trying to elope. And the teacher didn't understand why it was a big deal. She's like, he gets so mad, I don't understand. And I thought about this. I thought of this analogy in the moment. Again, I love analogies. And because I noticed it was like the opposite of gentle joining. She was just like, boom, over, done. And for her, her priority was moving on to the next part of the day, which I totally understand. But I shared this, it just like popped into my head in the moment. And I said, because I knew that this teacher loved self-care. She was like big into self-care, like getting her nails done. Like she really valued that, like caring for herself. So I said, Miss So-and-so, I want you to imagine you're 30 minutes into a massage. The lights are low. You're so relaxed. You're so in your body. The world doesn't exist. And then I kick open the door and I slam the lights on and I say, let's do your taxes. Go. You're probably going to be shocked and confused and have a really difficult time adjusting from one sensory emotional state to the one I'm asking you to join into. And she looked at me and she goes, oh my God, is that what I'm doing to him? And I said, I can't be sure exactly what his experience is, but I think when you're going in and cleaning up his things when he's in that relaxed state, it might be this like a similar state of shock to that like analogy I just gave you. And then from there, we talked about this idea of how can we gently enter in to his line making. And it turned out that music was a really helpful way to do that with him. So she was really open through that analogy, through again, relate. And it's funny because I related it to her interests to make that connection. Because if it's all about interests, it's how we can relate to people. She tried, and all of these things, they really helped. Were they perfect? No, transitions they're probably still hard for him to this day. But she would get down on the floor slowly. She even got down. I was so impressed. She got down into side lying position, which I was like, yes. And then she quietly sang a song, not about cleanup, because those are two very, very triggering words for a lot of kids. But she sang a song about the next thing they were going to do. So, like, time to go to the bathroom, not about the cleanup, but about the next thing. And it was so, so much smoother. He didn't like it, but because she gently joined in and didn't interrupt, I think his tendrils had time to come back in slowly. Now, oh, sorry. Do you have thoughts on that?
I love that story. I was thinking about, yeah, allowing for that processing time and then how giving that next little carrot, right? Understanding where we're going, what to expect, because time to clean up is fine, right? But also, then what? It's hard to sort of prepare your brain for how to make that shift if we're not sure like which resources we have to bring over, how much energy we have to allocate. Is there what's the buy-in to move, take all our things, pack it up and move it on over? So I think that's beautiful, the way that, and then those verbal routines, right, are so powerful with GLPs as a strategy. And even just any toddler, if we're thinking about that population, matching a song, right, or a jingle or anything to a routine is like, it's time for whatever when we hear that thing. And it could be a really great, I always have to remember to sort of use that.
Yeah, and then, I mean, I know you're sick of me talking about this, but when we're bringing in music, music inherently recruits the reward pathways in the brain. And so, I mean, maybe not always. Some people, I wish them the best, terrible singers, they might not be recruiting the reward pathways as much. But music, it really does, even if it's just rhythmic speech. So if you're not a great singer, even just using rhythmic speech, like time to go to the bathroom, that's going to route through the reward pathway. That's just what music does for the human brain.
Cuts
Now,
that
oh,
that signal to, sorry, it made me think that it cuts through that you speak so eloquently about the signal to noise ratio, or
yeah.
the figure and the ground.
Uh-huh. Yeah,
And
yeah, yeah.
I think that when we're right, like you say, lighting up those reward centers, and then
Mm.
also sort of like cutting through the other stuff. I mean, when we think about classrooms, that is like an acoustic nightmare for some.
Yes.
And there's, depending on, you know, the classroom itself too, it can be so intense, and you have all this constant noise, and even just trying to be a clinician, pushing into that environment sometimes, or pushing into with the younger children especially, it's like I come out overstimulated, right? So it's just like in a really acoustically noisy environment. And if there's constant noise during like free play or recess, are we going to hear it's time to clean up?
Yeah.
As well as like this really cool rhythm to get
Mhm.
us to the next thing.
Yep.
And
And,
yeah.
and we're also talking about memory too. I did a previous episode talking about that a very common pattern in the autistic neurotype is a working memory deficit. But musical memory tends to be stronger. And so if you're presenting something with just regular spoken input, it may not remain in working memory very well for your GLP or autistic client. But if you're singing it, it can help them with that transition. It can recruit the reward pathway, but it's also probably easy to remember. So there's so many reasons why I love music, and those are just a couple. I want to make sure we note the study from 2018 relating to kind of joining in to special interests and attention funnels for all my school SLPs out there. So it was by Rebecca Wood in 2018, and the study was entitled Autism, Intense Interests and Support in Schools, From Wasted Efforts to Shared Understandings. And this was all about what happens when teachers and support staff lean into a client's special interests in the and kind of try to embed the curriculum into the interest rather than ignoring it or using it kind of as like a carrot stick situation, saying like, oh, after you learn this, you can have 5 minutes of Angry Birds, or after you do your math, we can do football. But instead, they were looking at what would happen if teachers used talking about football to learn math concepts, or talking about Bluey to learn colors. And they found that when the autistic children were able to access those intense interests, there was this whole range of what Rebecca Wood called inclusionary advantages, because the teachers were joining students where their attention was already focused, and the autistic students were found to be more likely to participate in the classroom activities. There was more signs of independence in how they measured it, and there was more likely to be intrinsic enjoyment from the activities. A bunch of teachers also said that it felt like their job was easier and they worried less about the students. There was one example where there's one teacher, she felt really worried about one of the autistic kids in her class. But then when she discovered they both really loved Disney movies, they were able to connect over it. And she was like, oh, I know how to motivate him now, because we can kind of join each other in this Disney world. And I can like bring the curriculum into the Disney movie in a way. There were some drawbacks. Truly accessing like the curriculum itself, and especially tests, were harder because those can be more challenging to bring the special interest into. But in this paper, they're talking about there seemed like there are just far more advantages than disadvantages. when we're thinking about using the special interest as kind of like a vehicle. And so for those of you who are here for the live recording of this podcast, the link to that paper is in the live chat for you to check out. But I thought that was an interesting paper. And it's something that I definitely do I mostly work with kids who are like under 6 years old, but I do have a couple of older GLP clients, and their special interests are the vehicle for everything. I have been living in Minecraft for a couple years with one kid, and we can talk about anything hard in his life if it is through Minecraft. That is a safe world for him. And I gently join him there. And like we truly can talk about anything there because that is the safe place where his attention can be funneled and we can get to the hard stuff.
And there's interest there. And so there's not as much trying to connect it to something. That connection's already there. And then it kind of makes that sort of third wall that takes the pressure out of it being about maybe him, or like it can talk about it through these other experiences or like characters in a way, right? Like
Yeah, and that relates to there's this idea I think about of like it's exactly where I was going to go next actually. You're very good at that tonight. There's a blog post from 2021. It was by someone they call themselves Nanny Ott, and the 2021 blog post called Building Superhighways: Why Monotropism Works for Autistics. And Nanny Ott had this analogy, because I love analogies, where imagine kind of like the inside of the brain is a bunch of villages. And the brain is trying to build roads between so the villages can connect to each other. And these are like, you think about like neurons, synapses, or ideas. So there's all these different villages, and these roads are built between them as someone learns something. For neurotypical brains that are potentially more likely to be polytropic, there are many roads forming between many villages, and these roads are paved pretty easily. And this road can go here. We can get between lots of different villages very easily. There's lots of different roads. They're pretty well paved, similar distances, similar speeds. Maybe some are like 10 miles per hour faster. Maybe those are your hobbies or your career. Those are a little faster. But for autistic brains that are monotropic, the roads that form between the villages are less in number, but they are super highways. They are so well paved, you can go 75 miles per hour. And those villages have great relationships with each other. They share resources, they're sister cities, and these present as these special interests. And when I think about this analogy, I want to extend it. It's like I think back to my early practice or like the other therapists I coach who like we come into a coaching session and they're like, "Oh my God, I don't know where to start." I'm saying it sounds like you're trying to pave roads in different countries. You're trying to build roads in a totally different town and an unexplored land. Whereas I find a lot of success adding roads alongside an existing superhighway. Can we put a service road next to that superhighway of their special interest? Or can we create an off ramp? If they've got a superhighway about Paw Patrol, oh my gosh, do I have a Paw Patrol kid? I am living in that universe against my will. But I've fallen in love with it. I have. Paw Patrol in my head rent free. Think about what is an off ramp that can come off of Paw Patrol. So, like, just thinking about if their attention is already there, if their attention is speeding 75 miles per hour on the Paw Patrol highway, it's much easier to come off of an exit ramp than it is to take your car, pick it up, and put it on a totally different road somewhere further away. So I have another client whose superhighways are all about farm animals. Anything unrelated to farm animals is actually really distressing to him. Like he doesn't want to talk about anything except for farm animals. And so I use this passion, I use this superhighway in his brain as a vehicle for expanding knowledge and connection. And I'm thinking like, what can these animals do? What can they enact? What can they represent? And then like, what areas of challenge can I use farm animals as to kind of smooth it over like asphalt? Where can I build roads off of farm animals into like the rest of his life? And so there was this one time where he really did not want to sit on the potty. He was like, I mean, there's so many sensory reasons why that might be as well. But I was thinking, okay, from where I work, I don't know a lot about toileting, but I was thinking, okay, I know about special interests, and I was like, what if the farm animals sat on the potty? And I love drawing, so I love drawing during sessions. And so I made up a little song, and I love to sing while I sketch. So I sing and sketch. And I drew, and I kind of realized that this child, I think, identifies with the sheep. And I don't know if you've ever had clients who kind of, I really strongly identify with a character, an animal. I see it all the time with my clients. But this kid, like, he was a sheep. He really, really identified with that sheep identity. So I drew a sheep sitting on a potty, and I sang a song about it. And then that child went over, took one of my little chairs, and then sat on it and goes, potty, and sat down on the chair, kind of trying to, it seemed like acting as the sheep sitting on the potty. And then from that kind of midpoint, he was able to walk right into the bathroom and sit on the potty. Because it was this idea of I'm taking your special interest, I'm joining into it, and then I'm adding in kind of this off ramp to sitting on the potty. It was one of those experiences that I was like, that didn't just happen. It felt too good to be true, but it really followed this idea of this is an area that feels very safe for you. This is a superhighway in your brain, and I'm just going to show you, hey, there's this little off ramp here. You want to take an exit? Want to see what's at the exit? And he was like, yeah, okay, I can do that.
I have a client W
Yeah.
who is 7. Yes, 7. And he has a special interest in fans, switches, like light switches,
Ooh, yeah.
boats, and timers. And he is minimally speaking conversationally, but he he's a total communicator. He approximates, he uses his talker more than any client I've ever had that uses a talker. Like, and really uses it when he wants to, like when he's able to, and he can say a lot. He can put a lot together with that. He's multiply neurodivergent, and he loves like escalators, elevators, subways, right? Like all these things, music. He's a Swiftie. Loves Nirvana. Like, he's pretty cool. And so I kind of sense when he's one of those, like, if he has a large space, you will be running all over that space. And so even in, like, I've seen him in a couple different environments, and in his house, he's like all over, right? And his body, I think, just carries him there. I think that, I don't know if it's intentional or not, but he really loves these things. And he was, going back to the idea of gentle joining and skilled noticing, I would, like, he would want to set a timer. He would always want to set a timer. And then one day I gave him, and I was finding my footing with him. Like, we didn't quite have it yet. I did not know in the beginning if I just had this feeling like, and I always presume competence always, but I had this feeling like, I don't want to make whatever we're doing here too complicated that you can't feel successful. But I don't want to make it too, like, rudimentary for you either. Or, like, I want to match your cognition, but I don't know where your cognition is. And he really was, I mean, he's one of those kids that's really hard to tell. Then all of a sudden they'll start doing this thing, and then, like, you may not see it again for a while. Or so he was also, I had a feeling, I was wondering if he was a GLP, but I didn't have there weren't any of the typical sign, like, things that I would notice about a GLP. initially. And then over time, as have been getting to know him, I've been noticing more and more of these Gestalt sort of tendencies of like repeating the same kind of play over and over, or embodying something, or now that he's using his device, his speech generating device a lot more, I'm getting like gestalty kind of things where it kind of wasn't like that before, I think, because people were trying to like drill like 2-word combinations with him. So that's what it would be like help, or I want swing. And so I was getting a lot of that. And I was like, is this you? I don't know. But we had a relationship to build. We had work to do. A lot of work to do. So, back to the timer, he would grab my phone sometimes just randomly and open it, and like I have an Apple phone. And so he would open the clock, like timer app, and just like kind of get in this loop with it. So I have this app on my phone called Countdown Timer, and it's like a picture of something, a truck, whatever. And it sort of ticks down. And as it ticks, it reveals this picture. And then when the picture is fully revealed, as the clock counts down, there's like there's a change in the sound. So I showed him that, and he was like, that was all I wanted for a good bit of time. And I went, I had to really stop myself from like, you know, the clinical instinct is like, all right, enough of this, or
Oh,
whatever,
totally.
right? It's
Totally.
like, this isn't going anywhere, blah,
Yeah.
and I really had to
Oh, you got to
check
fight
myself
it
at the
every
door.
day. Yeah.
I always, and I'm like, okay, so we've got this timer. He's also, by the way, the only client I have a home clinic, and I told like his body just carries him. And it was in the very beginning of when I opened my clinic. It's in the bottom of my home. It has separate entrance and everything, but it is attached to my home. And he he just bolted out the door. And it was like new to me having the clinic, so I hadn't really figured out this piece yet, I guess.
Mhm.
And like I had locks on the door, but he figured that out in a second. Off he went. And that's where we've done therapy for like 6 months since then. But
Yeah.
he found my son, he went up into my son's room and he found the trampoline. His mom ran up after me. She was like, ah, I'm so sorry. I'm like, no, like, let's see where this
Yeah.
goes. Like, let's get curious about it. And she was like, are you for real? And I was like, ah, this is kind of cool. Like, what is it? Like, because he kept going up, and he kept,
Yeah.
he
What
was,
does this mean?
what does it mean? And he was flipping all the switches in the house, and he was looking at the fans. And then so that's sort of like the background of how we got up there. But he was flipping all look, and I think he's trying to figure out like what switch goes to what fan, like what
Yeah.
things connect, right?
Yeah.
Over time, now therapy is just in one room, like but so we're in the trampoline, there's a lot of movement, it's like an enclosed space that he feels really safe in, and he's got this countdown timer, and I'm like, okay, the clinician and me is like, all right, we've done this a lot of times already.
Yeah.
Because there's something obviously more interesting to him than there is to me.
Yeah.
And I had to really step back and say, like, okay, what is it? Like, what can I observe about what's going on? And I think it comes back to like the senses, right? All right, what am I seeing?
Yeah.
What could he be seeing? And like I noticed that he selects the same time frame. And then
Okay.
and, like the ticking of the clock has sort of like it goes like tick 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 tick. And it has like sort of this like really minor syncopation where like the first
Yeah.
tick is like slightly more prominent than the
Yeah.
second.
Yeah. Yeah.
And then there's this green band that kind of goes around and changes color as it gets closer to the timer going off. And there's a number that's counting down in the middle. And there's like tick marks that change in color from like green to yellow,
Mhm.
orange, whatever, to red. and then it always kind of spins around, and then the melody changes as you get to the thing. And so there's all these things like, I'm like, okay, there's actually a lot going on here. And
Yeah,
then the
there's a
last
lot to
2 seconds,
study.
it goes up in pitch, like just slightly before it like crescendos to the
Yeah,
melody. And like, does it spin the same way every time? Like, what is he looking at? I mean, he's really in the funnel. Like,
he's studying. Yeah,
studying is the, yes, that's like the best word for it. And like, what are we hearing, right? What are
yeah,
we, and then taking a step back even
yeah,
further, okay, is he changing when it changes? Like, what is he doing? And then I kind of like zoomed out a little to him, and I'm like, oh, he's like jumping and bouncing with the ticks.
yeah.
And
He's
then
embodying it.
so how I sort of gently joined was, so like one of the images that you could pull up is a number. It's the number
Mhm.
25
Yeah,
randomly. It's the only number. So just it, and it has a different tune. So like
yeah.
instead of like tick 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 tick, then it goes boo doo 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 doo. So I just started like embodying it like
Right.
in my body and drumming. And then when it changed, you know, I changed, and then he started doing that. And so we kind of came in together in this like auditory enjoyment of it.
I love that. Yeah, it's like you became part of the sensory experience. You made your body kind of mirror that. That's it.
And
That's
just like
yeah,
being in it.
yeah. You joined it. You made yourself part of the funnel in that. It's fantastic.
And then yeah,
Well, gosh, there's that's it. Well, we've talked monotropism, we've talked attention funnels, gentle joining, skill noticing. There's so much, and I could talk to you all night. But that does bring us to the end of tonight's episode. And for those of you who are listening live, as a reminder, if you're joining live and your state license requires live CEUs, be sure to complete all course modules, including the one that says complete course, before the end of the day on your speech therapy PD account. Thank you so much for joining the Gestalt Get Together. Thank you so much to Rachel Gorman for sharing your experience as an SLP working with GLPs. And we hope to see you at another speech therapy PD course. Thanks, everybody.